Great. Well, welcome everybody to International Health Partners' first summer seminar. Today we're going to be looking at the value of partnerships during COVID-19. I'm Adele Paterson and I'm CEO of International Health Partners, and we've got a great lineup of speakers this afternoon. We've got Alex Harris, who is Head of Global Policy and Advocacy at the Wellcome Trust, and Alex will be speaking on a survey of global health impact of COVID-19. We also have Claire Hitchcock with us. Claire is Director of Global Health Programs at GSK, and she'll be sharing an update on GSK's activities, which includes their support for NGOs and their collaboration with other pharmaceutical actors. And finally, we have Tom Cotter, who's the Director of Emergency Response at Project Hope, one of International Health Partners' partners, and he'll be highlighting the work that Project Hope has been undertaken during this time, and the complexities around disaster response, as well as the value of partnership during this time. A couple of housekeeping points before we start. The talks are being recorded and will be available pretty soon on our website, so do have a look out for those. The talks are scheduled to finish at 3 o'clock, leaving us about 15 minutes to have a conversation and to answer questions that we have. If you would like to ask any questions and you have any specific questions to specific speakers, make that really clear in the chat button at the bottom of the webinar. You may see the chat sign there. We'll be coordinating and collecting all the questions for the end of the session at 3 o'clock. As I mentioned, this is the first of 2 summer seminars that we're going to be running. This is replacing our usual annual sharing best practice that we host in London. Last year we were able to host that in London, and we were delighted to have over 50 people with us from across the world. We're delighted today that we've got so many international participants, and I know that several of you are at the very beginning of your day, so a big shout out to our friends who I think are at about 6 o'clock in the morning, and we have friends across the world as well. We have a second seminar which is scheduled for the 15th of July. We'll be continuing our theme of partnerships, but this time with the help of Janssen Pharmaceuticals and Elizabeth Ashbourne from the Partnership for Quality Medical Donations, and one of our in-country partners in the DRC, the Panzi Hospital, will be exploring the possible changing role of product donations at this time. If you're interested in signing up for that seminar, you'll be receiving an email at the end of this time together, and there'll be a registration link on there as well as a survey. So great to have you here. Thanks for joining us. And before I let our esteemed speakers loose on Zoom, I'd like to provide a brief update on what we've been doing at IHP over the last few months. So just bear with me while I share my screen. So for those of you who aren't too familiar with International Health Partners, I thought it'd just be good to provide a quick summary on what we see our role as being in the access to medicines environment. International Health Partners is an organisation that supports other organisations as they deliver in-country healthcare. We like to think of ourselves as a bridge. We work directly with manufacturers. We hold a WDA, which means that we are enabled and able to manage the product donations with approval from the UK government. And we liaise directly with a range of in-country partners to deliver long-dated, needed, and first quality medicines where they're needed. We were founded in 2004, and as I've already mentioned, we are a non-profit wholesaler. We are UK headquartered, but we also have a 501c3, which means that we operate in the US as well. We are quite a small team, as you'll see a bit later on when I talk about our impact. We've been able to deliver a good amount of impact because of a number of different systems that we've developed, including our unique donation system, which I will talk a little bit later, as well as developing the Sharing Best Practice workshop, which is usually a face-to-face meeting, and for these purposes of these times, it's going to be an online meeting. We're also the sponsor of the Generics Bulletin CSR Initiative of the Year. And for those of you who have already got a developed or a developing CSR program and you're from the generics industry, do look out in the coming weeks because we'll be talking about that award coming up soon. As I mentioned, we are the bridge between people that are able to provide medicines and those who are able to use them in an efficient way. But what does that actually look like for us as an organisation? In summary, that looks like disaster response. International Health Partners was founded in disasters, and since our formation in 2004, we've responded to over 30 disasters across the world. As well as responding to disasters, we also develop longer-term health programs, which means that we have partners who have long-term needs that we work with over a longer period of time. These can be country programs, they can be area-specific programs and therapy programs, or they can be around capacity building. And we run a number of these health programs. And finally, as well as doing disaster response and supporting our partners in the longer term way, we also have developed something called the Essential Health Pack Programme. These are kits containing about 800 treatments that NGOs and medics delivering immediate disaster and medical mission programs across the world can use. And this is a program that many of our corporate supporters manufacture to donate for, and a long-term range of products are available in those kits. As I mentioned, we're a pretty small team. There's just 12 of us. This year has been a not surprisingly busy year, and the team of 12 of us already this year have delivered almost 4.5 million treatments to partners working in 24 countries. We're able to do this because of the partnership model that we work to. So while we are the bridge between the manufacturers and in-country distributors, we rely on a network of logistics providers, warehouse support, obviously funders and donors that enable us to multiply the impact of product donations. For every £1 we are donated, we can deliver 3 treatments in country, and that's because of the impactful partnership model that we run. So for us, we find that partnership works. Very quickly, I mentioned earlier on that we are an impactful organisation, and one of the reasons we've been able to become so impactful is because of the development of a number of systems. Over the last 5 years, we've developed our own donation system, which means that companies and NGOs that are part of this gifts in kind ecosystem can upload product and be offered it and manage the full sort of distribution of products that have been offered and accepted and approved through a one-stop system. This is a system that we are benefiting from ourselves, and all of the NGO partners and corporate donors that we are engaged with are also using. And we're now beginning to talk to other people within the gifts in kind environment who would like to benefit from an impactful, transparent, one-stop donation system. So if this is something that you think might benefit your organisation, then do please drop us a note, and we'd love to show you a demonstration. During Covid-19, we have obviously had to adapt to a range of different changing environments. But at the beginning of this period, we made the decision as an organisation to continue supporting our partners' essential healthcare programmes. We had a concern, as did other players within this space, that the diversion of products and resources away from essential health programming would have a range of unintended consequences that we had seen in previous epidemics, such as an increase in child death rates, the re-emergence of treatable but deadly diseases. So we decided several months ago that we would focus on the continuation of supporting our partners' programs. To that end, we decided to clear our warehouse as much as we could with all stock that had less than 18 months dating. And as a result, as you'll see from some of the figures, we've been extremely busy, because while COVID-19 has taken up a lot of people's activities, the ongoing needs for essential medicines, for medicines that are treating non-communicable diseases, for mental health medicines remain. It's vital that we continue to do our work so that healthcare practitioners can continue to access all the necessary medicines for a range of problems and health conditions, even while supply chains are disrupted. And we are so grateful to our corporate partners who have continued the supply of medicines at this time, and also corporate partners that have been able to continue their financial support for us, as well as institutional and charitable funders who have shown a great deal of flexibility around the funding requirements that they have. So they've continued to support us, with many increasing their support for us during this time, as they've recognised the need for the work that IHP does to enable access to medicines. We obviously couldn't do what we do without our logistics partners, so we remain grateful to the work that DHL and Aloga continue to do for us. And all of these partnerships together mean that for us, we've been able to keep the flow of medicines going during this time. So that's why we are great believers in partnership. So just a quick summary of what we're up to as an organisation. And I'm delighted now to introduce you to the first of our speakers, Alex Harris, who's going to provide a summary and a survey on some of the global health impacts of COVID-19. Thank you, Alex.
Thanks, Adele. Really inspiring to hear that update, and fantastic impact from, as you say, a small team, but really dedicated and thinking innovatively. And I can say that slightly tongue-in-cheek because I had the privilege of working with Adele and many of the people at IHP for a number of years. But thank you for inviting me to speak to you all. I am going to try and share my screen, and so many different. Is that working for you? Can you see my screen?
Yes, Alex, we can see that.
You
Thank
can.
you.
Great. So I have the dubious honor, I guess, of being asked to talk about the impact of COVID on global health around the world. I lead the policy and advocacy team at the Wellcome Trust, and we are predominantly a funder of research and development. We spend around $1.5 billion a year on that activity from an endowment, but we are, as a result of what's happening with COVID, deeply involved in working towards solutions that will deliver equitable access to new products for COVID-19 around the world. So I'm going to talk a little bit about that to provide a little bit more hope in the outlook around the world. So numbers here that will be familiar to all of you, and they don't make for pretty reading. There are, I'm sure that number's probably out of date. That was yesterday, I think now, but well over 10 million cases reported of COVID-19. That's just the cases that are reported. And we know in countries where disease surveillance infrastructure is more lacking, that the number is likely to be much higher, and over 500,000 deaths so far. And I think what's very sobering about that is that whilst in Europe and in other parts of the world, the first wave may be coming to an end, the virus is very much accelerating globally. And I think it's important that we keep that perspective as we think through what that means for the next year or more. My boss, Jeremy Farrar, who is an epidemiologist and quite sort of vocal these days and sits on the UK government advisory board, believes that this is now an endemic human infection. And I think that really changes or should change our perspective on what we need to do to get the world in a much, much better place. I was reflecting as I was preparing for this on what's different about this, apart from the scale and the fact it's the first true pandemic in most of our living memories. I think it's become apparent to more of us that this is not just a health issue. It's about lives and livelihoods. It's about our economies. It's about the fabric of our society. And when you calculate those costs, not just the cost to human life, then we're looking at something with much greater impact than just the number of cases reported and the number of people dying from COVID-19. And to give that a little bit of perspective, we know that at the moment in the global economy, we're losing about $375 billion per month. So when we think about the costs of not acting, they are significant. They will be racking up into the trillions, and I'm sure we'll be counting those costs for many years to come as we better understand the full impact of COVID-19. So just a few thoughts about why has it been so bad, and we can all be armchair analysts at this point, but I think it's clear that there's a lot that we don't still understand about the virus. And certainly there was plenty of ignorance at the beginning, which I think we can attribute to some of the slow moving of governments around the world. Equally, I think it's true to say that some countries have more recent experience of epidemic outbreaks than we do in the West. And it's amazing how quickly our institutional knowledge can be lost of avian flu or any other recent outbreaks. So if you look at some of the more classic measures of preparedness for epidemics, the two countries that consistently come out of the top are the US and the UK. And you can see how meaningful these indices are when you look at the number of cases reported and deaths in both of these countries. So we do know that it's not just to do with technically how prepared we are, but to do with political leadership and the health and quality of investment in our healthcare systems. As I mentioned, I think there has been a disconnect between, or it's been a dawning realization that there's a strong link between the health impact and the impact on the rest of society, and that's something which has, or I attribute to some of the reason why we are where we are. But finally, and potentially as critical as all of those things, is that the geopolitics of today, the rising nationalism and the skepticism about multilateralism, in my view, is why we haven't seen more and better coordination between countries in order to halt the virus. And I'm going to talk about practically what that means in terms of sort of health terms, and some work that's being done to try and address that in later slides. So counting the full costs of the pandemic so far, just suggested there in those boxes some of the areas where it's becoming clear and people are speaking out about what those costs or predicted costs are. So what we do know is that there is large-scale disruption to large service disruptions in many countries. And I just wanted to pull out some figures for you about the known or predicted impact on other health measures. So it is estimated or predicted that COVID-19 could potentially double the number of malaria deaths in sub-Saharan Africa in 2020 in comparison to 2018. An additional 6.3 million cases of TB and 1.4 million TB deaths between now and 2025. And some of the figures imply a setback of sort of 5 to 8 years. So we are really looking at losing the gains that we've made in many areas of global health of the past 5 years or more. And I think that is very disheartening and sobering, and something we really need to address. And in the work my team's been doing on mobilizing financial resources to combat COVID-19, we've been very clear to say that it's critical that money is not diverted from these other disease programs. Equally, we know of, and many of you may be closer to this than me, of significant disruptions to supply chains in a world where we've been used to just in time, and others more knowledgeable than me are saying what we need is a supply chain that's just in case instead of just in time. It'll be interesting to see what changes are afoot within the industry to address our over-reliance potentially on active ingredients being sourced from China or generic manufacturing from India. Modeling from the World Health Organization suggests that a 6-month interruption to the supply of antiretroviral therapy in sub-Saharan Africa could lead to more than 500,000 excess deaths just in this year alone, which would more than double the death toll from 2018. And I think this is something that we really need to give us pause for thought. Equally, when it comes to access to medicine, some of you, I'm sure, will have been reading around the announcement by Gilead and their remdesivir product being the next 3 months' supply being bought out by the US. And I think this is a challenge to some of the work that organizations like IHP and indeed many generics manufacturers around the world will be working on. So a couple of suggestions, I think, that have come out from notable authors of things that need to be done to address those disruptions to supply chain. And we know that people are not coming into healthcare facilities to get treated because they're not sure whether they're going to come into contact with the virus. So changing some of the prescribing habits so that people can get more months of supply, meaning that they go to the healthcare facility less, or needs to go less frequently, but marrying that up with potentially telemedicine or using online services to make sure that patients are not disengaging with their healthcare providers, but also not getting in touch. And finally, when it comes to poverty, which is often very strongly linked to prevalence of and burden of disease around low middle income countries, we do know that in this case, the economic predictions coming out from the World Bank suggest that unlike the financial crisis of 2008, which mainly affected high income countries, the economic recession predicted over the coming years will hit low middle income countries, not as hard as high income countries, but it will hit them, and that will have a significant impact on numbers of the numbers of people experiencing poverty. So this next graphic just talks about the wider impact, and some of those numbers that I've mentioned, I can send you the slides afterwards if you're interested in it. But what the story that it tells is how all-encompassing the impact of COVID-19 is. And there are many organizations out there and perhaps programs that your company or your NGO supports, which are really struggling, both through an inability to deliver ongoing, for example, routine immunization programs when it comes to vaccines, maybe other things to do with supply chain disruption. In the case of reproduction health, it looks like there are stockouts of contraceptives that will materially impact populations in low and middle income countries over the next 6 to 12 months, which will lead to some unintended consequences. So a bit more positively, and I hope I'm not too over time, there is a way out. And I think that way out partly speaks to the real value of IHP. It's about true partnership. It's about cooperation. And it's about how we allocate scarce resources. And so within COVID-19 itself, there's a lot of work going on, which I'm involved in and helping to support, where governments are pooling their money and science organizations are pooling their expertise in order to develop more effective diagnostics, better treatments and therapeutics for COVID-19, and safe and effective vaccines as quickly as possible. But we do know that those resources, as they come online, will be incredibly scarce. The ability for supply to meet demand won't be there for the first 6 to 9 months. So there's a lot of work happening now, investing in building up manufacturing capacity and strengthening supply chains in order that the first vaccines available and those therapeutics proven to have significant cost-effective impact can be scaled up and distributed such that everybody who needs treatment can get it, not those who can afford to pay first get it first. And that's something which I think is increasingly clear is required for a recovery, a global recovery. It's no good any country, high-income country, buying vaccines for all of its population if it cannot trade with its neighbors or faraway countries who they rely on for the manufacturing of their goods and services. The last point I wanted to make on this slide was just about the way in which you're working. So we've certainly discovered that the solutions that are seeming to allow us to make progress on COVID-19 are not business as usual. We need to be taking significantly more risk than we have done in the past. We need to be thinking about compressing our timelines and our business processes. So in the vaccine space, for example, the manufacturers of some potentially successful vaccines are already making the vaccine at risk, paid for largely by public funding, in order that if the vaccine succeeds, we don't lose time and we're able to start delivering those vaccines as soon as possible. And that is very much not business as usual. So I think the fastest time a vaccine's ever been delivered in human history is 2 years, and that vaccine was for Ebola. And in the end, I don't think was used as quickly as it could have been, but mostly would be between 5 and 10 years. And so in this instance, it looks promising that we'll have a vaccine for COVID-19 within sort of 12 to 15 months, which is absolutely unprecedented. So there is a partnership. I just wanted to share this for any of you who are not aware, between a number of global health organizations who are working together to accelerate collaboration to ensure that we develop, produce, and equitably distribute COVID-19 test treatments and vaccines globally. And that work is proceeding at pace. There's a huge amount of money that's required behind that, and that's the challenge for raising that money. But in my view, that's probably the biggest hope that we can have as a global community to get out of this. And I'm really encouraged by the response from governments, by understanding that just tackling COVID in their own country won't actually allow their economy to recover. And so that there does seem to be now a groundswell of sort of solidarity that was sorely lacking in those early months of COVID-19. So I'll stop there. But if anything I've said has sort of jarred with you or provoked some questions, I'm happy to take those at some point. Thank you.
Thank you, Alex. So much you raised in that presentation, and I know that lots of people are asking for the slides, so please share those afterwards and we'll let people know how to access those. Some really shocking statistics about the comorbidity and the unintended impact of changes in funding at this time towards COVID. And thank you for the clear encouragement for people to keep on with existing health programs. And I'm sure some of the other speakers this afternoon will pick up on some of these topics. I'm sure Tom will be talking a little bit about how to get people back into healthcare facilities, which is so important at this time. Thank you, Alex. So we're going to hear now from Claire Hitchcock. As I mentioned, Claire is Director of Global Health Programs at GSK, and I'm sure we're going to be hearing more about collaboration from that particular company and across a range of healthcare sectors as well. Thank you, Claire.
So, hello everybody. I think I've got quite a few friends on this line as well. So, hello to you all. I can't see any of you, which but you can see me, and you know, this isn't my favorite kind of thing, talking into my laptop, and I feel very out of date or out of practice on my presentation. So please, you know, forgive me on that. But thank you, Alex, for that incredible overview. And yeah, I think it is right to finish on a more kind of positive note, but because we've all been through, you know, such a tough time. I think every single person on this call's roles will have been impacted one way or another by the COVID situation. So what I'm going to do is just say a little bit more about what we've been doing at GSK, which will include some partnerships, but also what we've been doing through our philanthropic programs as well. So if we can go on to the next slide. So as actually one of the biggest companies producing a vaccine, our support and our approach to COVID has been very much on our research and development, but also we've taken a very holistic approach, and that included, as with many organisations, a senior leadership team that met in the early stages on a daily basis to think about how, as an organisation, we were going to respond to this unprecedented situation. And so that was looking at our people, ensuring that we had business continuity and solutions. And the solutions piece is very much at the heart of what we do within our organisation through through finding and researching the best medicines that we can. And we're really fortunate that we do have highly experienced and talented colleagues who really wanted to put a lot into play in doing the right thing for researching medicines and vaccines for COVID. Next slide. So during this time, it has been, as I say, it's been quite incredible. And when I think about what we've been doing on solutions, just one example of many collaborations that we have set up is this partnership with Sanofi and GSK. And honestly, I've been with GSK for nearly 20 years now. I would never have thought that this kind of collaboration would have been possible, where we are sharing a lot of data, people and labs. I mean, all the kinds of things that typically in the pharma industry we don't do. Alex has also shown, a lot of other collaborations as well, and I would say that GSK is probably part of most of those, but this is the most significant one, and we will be going into hopefully going into trials at the end of this year, maybe before. And one of the other things that GSK has done is also, we said that we will make available, and it's already in production, is the adjuvant for the vaccine. So whichever organisation does find a vaccine, we will also be providing this adjuvant, which is something that you add to the vaccine that makes it go further. I think that's the most simple way of doing that. And so whatever happens, GSK will make sure that the vaccine that does come into play right at the beginning will be supported for efficacy and for kind of mass distribution where we can. Next slide, please. So you'll see, as I said, I've been really heartened by our colleagues and the way that GSK has been supporting COVID. Right from the top, our CEO has just really been supportive all the way through. But in our team and in our global health programs, we've also played a very critical role too. And again, really has reinforced why it's so important to have really good systems in place for philanthropy, because we and Michelle Clark, who you know from PQMD and from your interactions with her, she's been right at the centre of advising our companies across over 50 countries on the best way to manage donations, and that's cash and product. And you'll see from here that we have provided pooled funding for the World Health Organization and their response fund. We've also provided a lot of product donations. In fact, many of them have been consumer healthcare products. We have a big consumer business, and I think that in terms of employees and employee engagement, this has been something where we decided to take quite a top-down approach, but also a bottom-up approach, whereby our businesses in countries were able to mobilise a lot of resources, either through technicians supporting labs, product donations, but also supporting their local governments as well. And again, that's an approach that we've taken, which is we've been following the lead of country governments in our response. And it's not a surprise that probably a lot of the bulk of the activity has been within the UK and the US and our major markets. And the other area that we thought we didn't know, or something we didn't know that we were good at, and that was also mobilising equipment and PPE. And again, incredible approach in lifting some of our restrictions about what we can and cannot do in terms of providing equipment, and being very adept and agile at that. And you see over 700,000 pieces of equipment were donated, and you know, some of it was probably not best practice, but you know, finding things in our labs, but also enabling governments to procure in the best way that they could. So there's kind of a lot of kind of business business knowledge transfer in that. So again, great science, great support from our businesses and our employees. And if we go on to the next slide, I wanted to really emphasize in this piece is I don't think a single organization we work with hasn't been impacted by COVID, either because they need to change their programs, adapt them, stop some activities, and or even just, you know, in some cases put things on hold. And the partnerships that we have really focused on supporting frontline health workers. And it was really interesting to me to this, and this is primarily in developing countries. So it was really interesting to see, for me to see that within our own internal communications, we were using that language that we, through our strategic philanthropic efforts, can make the best impact in supporting frontline health workers. So whether those be NHS frontline health workers in the UK, supporting clinics in the US for underserved people, that's where we have put our resources. We've also been, as I say, been able to advise our businesses on best practice. And we've also been able to do some new things as well. So, I'm really kind of thinking about the use of technology in our work. And we've had the a very incredible offer from GSK's tech partners, which includes Accenture, Google, and others, who have offered to help us work with key partners to really look at how we can improve some of our responses by kind of upping the ante on technology. So that's something that has been quite incredible coming out of this, is that there's an interest through our partners to want to work with us to have better solutions for our COVID activities. So it still feels like it's been a pretty hard time. It's quieter, much quieter now. But I'm just amazed at what when I say our organisations, I'm not just talking about GSK, I'm really talking about organisations like IHP, America's, others who, always come up, Trump's not the right word, but always come up with the solutions and ways of addressing what are effectively, emergency and humanitarian situations. And I think this network that we're involved with is so important. And in the US, where we do have partnerships with America's and Direct Relief, our US business has chosen to work with them in delivering programs for the US community. And so, I wouldn't always have expected that, because we work with those organizations internationally. But it's enabled us to really build on that. So I'm coming at this, as I say, in a very, very positive way. I think our pharma companies have such a critical role to play in continuity of medicine supply, not just for treatments for COVID, but making sure that where we can, other other medicines are available. I'm sure we're going to hear about how do we keep people coming into the clinics and getting their treatment as well, and that is really, really important to us too. So I'm going to finish there and thank you for listening. And if there are questions later, we'll take those and see what we can do to answer them. Thanks.
Thank you, Claire. Great to hear and to get a really good in-depth picture of what you're doing as a company. Unlike so many other companies, doing a whole lot of things at the international, national and local level. As Alex mentioned earlier on, we're all being affected by this in a variety of different ways. And I guess that's one of the things that you're beginning to see. Things like consumer products are as important in a way as the pharmaceutical products, as everybody's lives are affected, whether it's their income as well as their health. So great to hear more about that. We look forward to hearing more about some of the partnerships. And if you have got questions for Claire or for Alex, do remember to put them into the chat. We've had a few questions on already. I know we're raising a range of different topics here, and we've got some experts, so do make sure that you get them while you can. So thank you, Claire. And now we're going to hear from Tom Cotter. As I mentioned, Tom is the Director of Emergency Response at Project Hope. International Health Partners and Project Hope have been working together for a few years. And actually, we're also members together of the PQMD network. And I think over the last couple of years, we've worked with Project Hope and supported work in about 5 countries. So Tom, we look forward to hearing more from you as well. So over to you.
Thanks very much. And Adele, can you just confirm you can see my screen that I've shared?
Yeah, we can see that. Thank you.
Awesome. Well, thanks very much. And thanks to IHP for really being a thought leader in getting people together to think of different collaborations. One of the things that really struck me, especially from Alex's presentation, is this is not business as usual anymore. The old models that we relied on for decades don't apply as much anymore, and we really have to find innovative ways to approach the way we do global health, to approach the way that we do, especially emergency response. That's the case I want to make today. I want to show you a little bit about what Project Hope is doing, but also make the case of how that we can how we can move forward, a pathway forward, and see if there's ways we can collaborate together on that. So thanks very much. I'm going to advance some slides here. So just by way of introduction, I'm the Director of Emergency Response and Preparedness at Project Hope. And Project Hope's mission is to really put all the resources needed in the frontline healthcare workers' pockets so that they have what they need to tackle whatever health problems are being faced by the communities. We're not a disaster response organization. We're a global health organization that does disaster response. And that identity is really important because we bake that into our emergency response capabilities, where we factor in capacity building as a central tenet of everything we do programmatically. So we do, of course, the immediate life-saving activities, but as soon as we can, we pivot into capacity building to have lasting change in the communities that we operate in. So we're a nonprofit. We have about 600 employees worldwide. We're operating in about 20 countries. And we also have a peer-reviewed journal that operates as a health policy document that is widely resourced and, of course, is really these days focused quite a lot on COVID. So here's a quick snapshot of where we worked. As you can see, we work in maternal child health. We work in infectious disease, non-communicable disease, or NCDs, and then we do disasters and health crises. And this is just a brief snapshot. Of course, from 2019, it's going to look a lot different this year. So stay tuned on that. I put this slide in here just to emphasize that everything we do, we put the healthcare worker in the center. We want to have every effort that we make be towards empowering healthcare workers, frontline healthcare workers, community healthcare workers, doctors, nurses, etc. And we'll talk more about that as we go through this. Now, a little bit about our gift in kind, and Adele was kind enough to mention that IHP is a key partner of Project Hope, we use gift in kind very strategically, and again, to build capacity, whether it is surging or whether it is doing cost savings for our health partners on the ground who've been affected by disasters. Now, what I mean by that is when we are able to provide gift in kind supplies, medicines, medical supplies to a Ministry of Health or to a hospital, they can either use those right away to start treating patients because they didn't have this in their inventory beforehand, or they can use the resources saved that they would have used to buy these through vendors to then focus on other programmatic areas. One of our key partnerships in non-emergency response is the strategic resupply program that we partner with IHP on in the Balkans. And this saves millions of dollars that governments in the Balkans can now reallocate and do reallocate into renovating hospitals and providing other equipment. So it's a really key aspect of our work, both in emergency response and through our normal global health development programming. I'm going to talk a little bit about COVID. Project Hope found ourselves on the front lines of COVID in January. I know this timeline starts in March, but in January, we started our response around January 20th. And that's because we actually have an office in Wuhan, China. And so we started, when there was only a couple hundred cases, we started mobilizing gift in kind to actually import into China. And we found ourselves very successful in doing that because we had a 30-year presence in China, had opened a nursing school, had opened a children's hospital. And so we knew a lot of the bureaucracy, and it's a notoriously difficult place to work and especially import into. But we were able to do that pretty effectively to try to protect, again, the frontline healthcare workers with shipments of PPE. So quickly, come February, we started to see where this was going, as the rest of the world was also doing. And we started to think about how we can reorganize our existing programming, our existing organizational infrastructure to match the needs that we are going to anticipate for the COVID pandemic. And what we came up with, first of all, was a complete ground-up assessment of how each one of our country-level programmings can be retooled and reconfigured to either add COVID preparedness to it or response, or we completely redesigned our programming to focus completely on COVID preparedness and response. And this was really important because we wanted to build capacity beforehand. And the other thing that we did, which is what I'll talk about a little bit more, is we built this international training program. And I'll talk more about it. I can share the link with everybody, but we developed a comprehensive curriculum for healthcare workers' preparedness and response to COVID-19 at all levels. And this was a way for us to reach a lot of people really quickly. As of right now, we've reached about 25,000 healthcare workers with our training. We turned it into an e-learning. We're very proud of it. I won't go through the rest of this. I'll share the slides afterwards. But our global response strategy was to immediately build capacity. We want to provide healthcare workers with PPE and other critical medical supplies. And we want to strengthen overwhelmed and weakened health systems. And this is going to continue throughout this year. We are in hurricane season here in the Western Hemisphere. Hurricanes are already hitting in Southeast Asia, and we'll talk a little bit about that. But this is going to become massively critical when we talk about sudden onset disasters on top of COVID. And that's what I want to talk about today. I'm going to skip this, but suffice to say, we've done a lot with quite a little, and we've done it over a wide area to reach as many people as we can. Here's our reach right now. I think this shows a better example of our reach with both our training, our medical supply and PPE programming, and our programming around the world. This is as of last week, and it's what we've done and started up since January. So quite an impressive infrastructure we built really, really quickly. But the argument I want to make is that we have to change our emergency response model. For a lot of NGOs, Project Hope included, we rely on sending Americans from the US and Europeans to sudden onset disaster areas. We can't do that anymore. We find ourselves in a position where there are travel restrictions. It's irresponsible to send someone from the US essentially anywhere in the world right now because we might be contributing to the spread of the pandemic. You know, a lot of countries are putting logistical challenges in place, quite rightly, to quarantine people, both coming in and going out. So we have to break this model. We have to break this reliance on human resources deploying. And what that means is we have to find local partnerships. We have to be building capacity from the onset and even before sudden onset disasters hit. And I think that this is critical in this time of COVID. And the ways that we find local partners is by having conversations. I think that having a presence in place, having a relationship that is pre-built before the sudden onset disaster is critical to the success of this. Because no one, when an earthquake or hurricane hits, wants to start that relationship building process. It has to already be in place. So Project Hope, through our our global training infrastructure that we built, we've been able to identify these partners because we've essentially done a TOT, a train the trainer program, where we find a local partner, hand the materials, train them, and say, this is now your training. Go out and train to the farthest reaches, to the last mile, to make sure everyone who needs this gets it. And through that process, we've, again, identified these local partners that now we're turning to when sudden onset disasters hit to say, listen, we're here to support you. We know we did the COVID training, but how can we support you specifically for this earthquake or this cyclone? And the ways that we do this are technical assistance. And technical assistance in a lot of times traditionally has been WASH expertise, nutritional expertise, med-surg expertise. But we're looking at Project Hope, we're looking at ways that we can support them with financial management, with HR management, with contracts management, things that are really uncommon potentially in traditional emergency response. Training, again, if they have medical teams, if a local partner has medical teams, how can we provide them access to training that will build capacity and improve the quality of care for patients and the ways that they manage their inventory, ways that they manage their waste, ways that they can implement WASH and sanitation in their camps. So thinking outside the box and being innovative in what we can provide to people. And again, the third one is one of the most critical ones, which is access to resources. This is funding, yes. We want to connect our partners to funding that they normally would not have access to, and help them manage that funding and spend it themselves. And maybe they're the prime on this grant, which is a bit different than the usual model. But it's also access to this gift in kind. I talked a little bit about a hospital in Bangladesh, a hospital in the Balkans that uses the cost savings from gift in kind in critical medicine and medical supplies coming from IHP to reallocate into hospital rehabilitation. And so there's, again, and I don't want to be reiterative here, but this critical access to our networks as a larger INGO is going to be absolutely massive to these smaller local NGOs in how they can respond. And our job now at Project Hope is not to come in and find the solutions and fix the problems. Our job now is to come in and support other smaller local NGOs to go and fix their own problems. This is going to be massive moving forward. Another thing I'll add, because I think I'm running out of time, is that there's usually two waves to every disaster. There's the original disaster itself, whether it's an earthquake, cyclone, or other, and that usually causes a lot of trauma and traumatic injuries. Then we have the illnesses and the mental health approach to supporting communities that usually are the second wave. But what we're going to see now, I believe, and I think a lot of public health folks agree, we're going to see a third wave where until there's more effective reduction of transmission in these countries, we're going to see a third wave of COVID outbreaks and larger numbers in death and larger numbers in infection rates. And Alex spoke about the impact of COVID, and we saw this for Ebola too, on every other health service. The ability for health systems to provide other programming for other infectious disease or non-communicable disease is going to be impacted and going to be greatly reduced when they're battling COVID. So we have to prepare ourselves for that as a international network of NGOs to make sure that we're saving and we're incorporating COVID preparedness in all of our programming. And a key part of that is making sure that the tools are in place and the resources are in place for local entities to implement. And so let me stop there. I'm out of time. but I'll be around for questions. Thanks very much.
Thank you very much, Tom. Really interesting to hear how not only are you having to think really carefully about preparedness, but also the pushing out into local communities as a result of COVID. And I think that's a trend, obviously lots and lots of people within this sector are wanting to see anyway, and how interesting that along with change in some business models, some of the trends that we wanted to see have been accelerated because of COVID. Yeah. And I think that's really encouraging, and we really look forward to hearing more about that. Certainly as an organisation, IHP is really keen to see how we can equip our partners as well, that it's not just about us giving things and doing that on a repeated basis, but upskilling and sharing learning. And I think these sorts of platforms where you've been extremely generous as an organisation in sharing a lot of your resources, and we're seeing that across the whole network as well, of people sharing resources to ensure that frontline health workers are equipped to be able to do their job properly and that they're safe. So that was a really interesting talk, and I know there's lots and lots more to say, and we could have had an hour from each of you. So thank you so much to both to you and to Alex and to Claire as well. We have a few questions that have come in, so do make sure you ask some more questions. We'll make sure that we share resources afterwards as well. We've covered the whole range, we've covered the whole world. It seems like we've spoken at a very high level, looking at these international alliances, right down to the individual healthcare worker that is as skilled and as trained as well as they can be. So do get thinking about these sorts of questions that you have. One of the questions that has come in just before we started this seminar, Tom, you were mentioning that you had been in London for a pandemic preparedness session just in December. Were you prepared as a result of that kind of training, or what have you learned as a result of that, given your experiences now?
I don't think I'm exposing any vulnerabilities by saying we weren't prepared. I can't put my finger at anybody who was, overwhelmingly prepared for this. It's not that we didn't see it coming. We certainly did. This has been a topic of conversation for a very long time. What I think is potentially, well, let me actually take a step back. This conference in London was a USAID funded initiative called the READY Initiative. And what it was specifically targeting NGOs and defining their roles in pandemic response. And I think that was really key. One of the topics that has been missing from a lot of the pandemic preparedness conversations, planning efforts, and readiness has been, what role do INGOs play in that? And I think that's we started to have that conversation in 2019, which obviously was not enough time to really fully flesh that out. And I think that we're going to be really purposeful on how this happens and how this rolls out into the recovery. Because what we're seeing here is that governments are being very careful in strategically deploying, as Alex referenced again, scarce resources. And INGOs are playing that cross-border role that is missing, because in previous outbreaks, and certainly we saw this in Ebola, there's a lot of bilateral aid going around, and we're seeing that a little bit less. Certainly resources are flowing, but as I mentioned in my presentation, not that boots on the ground part of that. And so we're going to have to really continue to have these conversations. I think this is a great venue for that, and how INGOs coordinate private sector, public sector, and even among peers in changing the models and really defining what our role is here moving forward.
Thank you. And Claire, are you able to speak a little bit to kind of company preparedness in this way? And not to put you on the spot, or GSK on the spot particularly, but was there obviously an awareness of something coming? Anything that you've learned as a company?
There is a lot that we've learned as a company, and no doubt there will be some form of publication internally for that. I think what has been clear is that through our business continuity programs, which are global, that those came into play very early on, and like Tom described, because of the situation in China, GSK had already got some experience of what to do, and it really starts with employees. How do you keep employees protected? The whole working from home thing. So I think from a human resources perspective, that was very effective. I think from a research and development, the preparedness is, again, it's built into our organisation because of our science, and that adaptation of our scientific research is something, again, it's quite innate in our organisation. I think I just don't think we were prepared for the scale. I think that's really what has challenged all of us, and everything coming together. So multiple countries, thousands of employees, and recognition that the role that we have, along with other organisations, to provide the vaccine. I think there's a lot of that's where we weren't prepared, is the pressure that's on organisations like ours.
Yeah, thank you. Alex, you've mentioned, Alex, a few of the initiatives that the Wellcome Trust has been involved with. And I know that you've had some very interesting sort of big money initiatives that you've been part of. Are there good examples that you'd like to share with us of real cross-sector collaboration that you've seen that we haven't heard about so far in response to the COVID-19 outbreak?
Good question. So I might answer it slightly differently to your question, if that's okay. Just to talk about where there's good collaboration and where more collaboration is needed. I think what's been very good to see is that beyond the politics of this around the world, that as Claire was saying, at the level of where the science is done, international collaboration is the norm. Perhaps not between companies, but certainly at the early stages of research within academic institutions. That's just the way things happen, and it has been very good to see the spark that collaboration has given to the different development efforts. So there are now well over 100 credible vaccine development efforts happening around the world. And that might sound really inefficient, but actually is really important, because the history of vaccine development tells you that if you want a vaccine that works and you want it quickly, you need a lot of different development efforts and shots on goal in order to get one or a few that work. So the collaboration of different efforts and investors to get behind those efforts has been really good to see. Similarly, there are organizations out there who exist as alliances and partnerships to help low and middle income countries get access to the most promising products. So Gavi, the Vaccine Alliance, and a much newer organization called CEPI, which Wellcome helped establish, which stands for the Coalition for Epidemic Preparedness Innovations, which is a bit of a mouthful, but is essentially an organization that provides push and pull funding to help the small biotech companies who often are developing the technology to then give them access to capital that enables them to take their products to the stage where big pharma can then take them on. And for those companies, big pharma companies that may not have their own candidates already under development. So there are some innovative partnerships out there that are growing in scale and impact. I think what's missing is, frankly, political partnerships. So what I would have hoped to have seen by now, were it not for the politics playing out and in rising nationalism around the world, is that the G7 and the G20 would have mobilized collectively either the financial resources required or the global health security measures required to implement across the board that would have meant that we could have halted the spread of the virus, or it certainly slowed it down better than we have done so far. So good on the science side, not so great on the politics.
Thank you. Tom, we heard a little bit about people not going into health centres. I wondered if you could talk a little bit about how health services have been affected where you're working. Are you seeing fewer people going in because of the worry about COVID, and how is that affecting the needs, and how are you addressing that?
Sure. It's it is a bit varied. It kind of depends on how communities feel about COVID. If it is something that they're acutely aware of, they understand it, they're potentially fearful of it, then I think access to healthcare is a bit it's challenging. And I think that's where the risk communication comes in, where how we're talking to people about this, how we're communicating about them, is key to making sure that they maintain good relationships with their own healthcare system. I think engaging, and this is part of our training because this was a lesson learned from Ebola as well, training doctors and nurses and healthcare providers on risk communication, and even to the point of making sure that the social stigmas about COVID are addressed in this. Again, make people a little less wary of going into the hospital. But I think worldwide we are seeing a withdrawal, if you will, or maybe a additional caution as people access their healthcare systems. I'll say even personally, my partner potentially broke her ankle, and we were fearful to go into the ER. And that's a public health professional who's working on COVID. So it is really universal, I think, but I also think that this is going to ebb and flow as different communities react to this differently, and as transmission rates go through different communities in different countries, and the way that they're addressed. There's going to be a level of comfort that is going to be changing. And I think what will be really interesting for me as an emergency response professional is how this is going to affect emergency responses, and how international NGOs are going to be viewed for providing aid, and how people are going to access potentially overwhelmed healthcare systems. And that makes the assistance thereof all the more important.
Thank you. Thanks. We've just got a couple of minutes left, and I wanted to ask all of you the same question, if that's okay. We are all united, certainly around the Access to Medicines initiative, those of us who are gathered here. Each of us are playing a different part in that. I just wondered if there was anything that you wanted this particular community to learn from this time, and perhaps what's the one lesson the Gifts in Kind community can take away from this? And I just wondered as well if you saw new opportunities for this particular community to support the ongoing Access to Medicines cause. Tom, do you want to start?
Sure. I think my one message is we have to decentralize how we do our operations on the emergency response side, and also on the global health development side. As we centralize our partnerships, I think we have to decentralize our actual operations. It's going to put the resources closer to the people that need them in a time when logistically and operationally it's too challenging to move people and things great distances. And so it demands a lot of foresight in being strategic about what that looks like. And your first question to me was how, were you prepared? And the answer is not really. But also at the same time, at Project Hope, we've been trying to decentralize our programming for a very long time. We have almost no expats on our staff. We are training our country offices to do emergency response. We're training our country offices to identify partners and donors where they lie. And our new initiative in the time of COVID is to decentralize how we do Gift in Kind as well. Are there ways that we can get things to people faster that requires a little less involvement at the headquarters side? So my one message is to decentralize. And thanks very much.
Thank you. Thanks. Claire, anything you'd like to add to that?
I think the lessons learned for us is, actually don't underestimate what you can do, and by that I mean within all, as I say, all our organisations have been impacted one way or another, and it's really hard. I think it affects people personally, but once they've moved on, how it impacts them personally, they think about the wider organisation, and I've seen that with our partners as well. So a lesson is, let people go through. They need to go through it, and then they come together to kind of do do the business activities, what we're here to do. And that, I don't know whether that's a lesson learned or whether it's an observation, but I believe that in the experience that we've had from doing emergency response, because I've seen the pattern, I was able to encourage, and an upward level as well, encourage our senior leaders, to kind of stick in this. You've got to play the long game.
Okay, great, thank you. So there's a real encouragement there that actually there's a lot that can happen, even though these times are difficult, and we just need to stick in there. We can do more than we realise. Yeah, I think that's certainly been the experience at IHP as well. Alex, any closing thoughts from you about lessons learned or how that applies to gifts in kind?
Yeah, I see there's a question there from Hannah about sort of what's the role of GIK and that kind of stuff. So two observations. One is the evidence of the fragility of health systems of many countries around the world, and the critical role that gifting kind can play in that. It's many of the countries which IHP is able to reach, thanks to the generosity of your donors, are only ever sometimes a month away from not having critical medicines in stock, and oftentimes nothing in stock, which is why you're responding. But the other point around linked to that fragility of the health systems is that for COVID and for many other diseases, it's the comorbidities, right, which present the risk factors. And where you are able, and where gifting kind can play a role in helping healthcare practitioners and health systems to address those comorbidities as well, you could be playing, and I'm sure are playing, an absolutely critical role. And as we know very well, if you're the health or finance ministry of a low and middle income country, your budget is never going to be what you need it to be. And so when you're faced with a choice between trying to access some COVID-19 products that are coming down the pipeline, for which you don't know what the price is going to be and you don't know what the supply is going to be like, or tackling these other health problems, it puts you in a very, very tricky place. So for me, gifting kind has a more important role to play than ever before, because what you're offering countries is a bit of relief in order to be able to make clearer decisions between what they can and can't do at a time when they'll never have the budget. And not only that, but their economy is likely to be shrinking over the next year or two.
Thank you. Well, thank you, Alex, for those words, and also for Tom's words, and for Claire as well. It's been great to have you as part of this session. We're extremely fortunate to have such great partnerships. So thank you to everybody that's on this call, that is part of this ecosystem. And let's just be encouraged that we are managing to do quite a lot in very difficult circumstances. So let's never tire of doing good. So thank you, everybody. There'll be an email after this so that you can sign up for the next webinar. And the only thing that remains for me to say is thank you to the audience, and also thank you to Lydia Amate, who's the Corporate Partners Manager at IHP, who has pulled this whole event together, and for Richard Inslee as well for his technical support. So thank you to them. Thank you to everybody. I'm sorry we haven't been able to get through everybody's questions, but who knows, you might do something like this again soon. So thank you to everybody. And if the speakers can just stay on the line for a few minutes afterwards, I'd be very grateful. So thank you very much.